Don't be afraid of failure. And I hate the word failure, but if you're not failing, you're not pushing the limits of your own abilities and the limits of technology. If you're going to fail forward.
Welcome to Threat Vector, the Palo Alto Networks podcast where we discuss pressing cybersecurity threats, cyber resilience, and uncover insights into the latest industry trends. I'm your host, David Moulton, Director of Thought Leadership for Unit 42. In today's episode, I'm going to be talking with Jim Foote, the CEO of First Ascent Biomedical. Jim and I will discuss his current mission at First Ascent and some of the inspiring work his company is leading using their ML/AI platform to rapidly identify therapeutic solutions for cancer patients where the options for standard care have been exhausted. We'll also discuss how Jim's background in security informs his work in the medical field. Jim uses the lessons learned as a CISO from deploying and using cutting-edge technology to fighting cyber criminals in his fight against cancer, and reached out to see if he'd be willing to share his story about the shift from CISO to CEO with the Threat Vector audience. I'll have a link to the IT Brew article in the show notes. Jim, thanks for joining me on Threat Vector.
Oh, thank you for having me.
So your transition from CISO to leading an organization using AI to fight cancer is quite dramatic. Talk to our audience about what drove you to make this shift.
Yeah, the reality is that we've all been affected by cancer in one way or another. And most of us remember exactly where we were and what we were doing when we heard that word for the first time. And for me, it was October 19th, 10 in the morning when my phone rang. And I heard those words at the other end of the phone, cancer. And as much as I wanted them to be about me, they weren't. They were about my son, Trey. Instantly, I was thrust into that world of cancer. Again, much like, as a CISO, when the phone rings and all of a sudden you find out you're under attack. And we went into attack mode and we started trying to resolve this problem. And like every other patient, we thought we were going to beat it. After 8 months of grueling chemotherapy, the doctors came back and said, your son's cancer's returned. And then they asked me what I wanted to do next. And I was surprised because I'm not a doctor. I'm a CISO. But I knew it was a solvable problem. And so I did the research. Obviously, I couldn't solve this problem in time to save my son. But I knew it was a solvable problem. And that's really why we started the company.
And before I get into talking to you about that transition from CISO to CEO, I sat down and I'll say read your company's article that you had in April in Nature magazine. And the reason I say read is I might have had some assistance from a GPT to unpack it. It's a bit deep for a simple guy like me. But your article discusses the feasibility and clinical impact of what's called functional precision medicine, so FPM, in treating pediatric patients that have relapsed or have refractory cancers. So can you talk to our audience a little bit about what functional precision medicine is in simple terms and how that differs from traditional cancer treatments?
Yeah, so what functional precision medicine basically means is in treating a patient with cancer, all of the data and the treatment protocol is based on the individual. It's based on you. So, David, let me give you an example of how cancer is treated today for the most part. It's called the standard of care. And what it's really based on is if you look at you and I, we're different ages, we're different nationalities. But if we got the same cancer, we would be treated almost exactly the same. It's a recipe book. It's called the standard of care. And it would vary a little bit based on our age and our weight. But the treatment plan would be almost exactly the same drugs, the same regimen, the same. But look at us. We are completely different people. We're
Right.
biologically different. We look different and we're biologically different. And what functional precision medicine does is it says, let's take and treat you based on you, your biology, and create an individualized plan versus a plan based on a whole bunch of people that hopefully look like me.
So I'm immediately drawn to this idea that in security we may have a playbook, but based on our threat intel, our environment that we're protecting, where the most important data or asset for the business is, we would shift that playbook. You might start with something that's a standard of care, but you optimize towards what you're trying to protect. But you're telling me that for the most part, you go in and they go, "How old are you? How much do you weigh?" And dial up and down a couple of variables rather than say customize that playbook specifically for me. Is that right?
That's correct. So, again, in cybersecurity, we have run books, right? We have run books for every scenario,
Yeah.
but it's just a generalized guideline. You have to be able to, in incident response, you have to be able to pivot based on the threat. In cancer, again, they stick with the standard of care, which is they don't generally deviate from the playbook. And then when, what that results in America in 2024, 1 in 3 cancer patients will still die. And again, while we can move the needle by altering the playbook over time with lots and lots and lots of people, there hasn't been really any quantum leap forward uh, in the standard of care.
So you've mentioned that you see a correlation between how cyber criminals and cancers behave. And you said that your experience as a cyber defender informed your thinking in the fight against cancer. Can you talk a little bit more about that approach? I know you've touched on it, but I want to go a little deeper.
When you think about the parallels, you think about the characteristics of a cyber attack or a cyber criminal. They want to evade detection. Oftentimes, they're within your network for weeks or months. You don't even know it because they want to evade detection. They constantly evolve and want to traverse through your network and really make their ways to the crown jewels. And they'll take everything from you. When you contrast that to cancer, it's exactly the same way. It continually evolves, it wants to evade detection, and it will take everything from you in the end.
In the study, it mentioned that you provided an actionable treatment option within a clinically relevant time frame. Can you talk to the audience a little bit what that means for patients and their families, and how could this impact their experience with cancer treatment?
Yes. So we know statistically that for every day or for every 30 days you delay cancer treatment, your mortality goes up by 10%. What clinically actionable means is that we can take a biopsy, we can return results that will actually benefit the patient, and we can do that in less than 10 days. And so that's what's considered a clinically actionable time frame, to be able to alter that standard of care based on guidance that and information that our tool provides.
So, speed is always the ultimate feature in conversations in security. I think what I'm hearing is that speed is the ultimate feature in cancer care.
Yes, speed is the one thing that you can't get more of is time. And what's interesting, David, is again, having been on the patient side and now having to deliver a technology like this into the industry, I understand both halves. When you're a patient or you're a parent and all you can see is that clock ticking, and all you can think about is that cancer rapidly dividing, rapidly growing, potentially metastasizing and circulating within the body. And you want to attack it with everything that you've got. Imagine being in the middle of a cyber incident and having to wait 10 days for Palo Alto's team to deliver some forensics information or to deliver a EDR tool that would help them better contain the situation. That's the same mentality you have to have when you're fighting cancer. It's got to be that sense of urgency, but more importantly, that sense of urgency with the clinical efficacy that will give you the precision that you need to ultimately fight this foe.
So, Jim, you've got this extensive background in cybersecurity, and that's influenced your approach to leading this AI driven biotechnology company. Are there any particular principles or practices from your IT security days that you find particularly valuable in your current role as the CEO?
A CISO is always looking for, we're problem solvers, and if we do our jobs perfectly, nobody knows we exist. My goal here is leading this company is to assemble the right team, to bring the right technology together, and to be able to solve this problem of cancer in a way that's going to benefit every patient whose cancer's returned. A good CISO is never the smartest one in the room, but they bring the right people with the right skills and the right technology together to solve some of these complex problems. And that's really been my mindset, is to really, bring the best in biology and the best in technology and the best in artificial intelligence, and let's bring us all together and solve this problem.
As you made your shift from leading security to leading a company, who did you lean on for support?
That's a great question. There's a number of areas, again, you think about, as a CISO, you move into a new company. What do you have to do? You have to understand the landscape quickly. You have to understand the weaknesses. You have to understand the strengths. And then you have to, try to assemble a team and attack a problem. We've built an amazing board of advisors that are made up of medical doctors, insurance executives, serial entrepreneurs, people that have taken, the head of our board of advisors actually took Cambridge Technology Partnership, again, another tech company, and grew it to a multi-billion dollar company before they exited. And so when I entered this world, I realized that I needed, again, to surround myself with experts. I've never started a cancer company before, but I needed experts in the medical industry, in the insurance industry, in pharmaceuticals, and in startups, because ultimately, there are so many gatekeepers to bringing a technology like ours into the industry, that I had to make sure that I saw every aspect and could anticipate any resistance that we would have in bringing something like this to market. You know, in the end, the biggest difference between what I did as a security officer and what I'm doing now is these decisions are literally life and death. If we make a mistake, somebody could potentially not respond properly to their cancer treatment. As a security officer, ultimately the fate of companies, are at hand. And if you have physical security as part of your responsibility, which we did at ADP, yes, you're protecting people's lives. But in my career as a security officer, nobody died. And that's, I think, the biggest difference here is you have to understand you're literally working with people's lives. These are moms and dads and husbands and children. And we never want to lose sight. It's more than just a clump of cells that sit in a petri dish that we're testing drugs on.
Jim, you've mentioned what sounds like an incredible lineup on your board of advisors. Those are the folks that can mentor and advise you. And I'm curious how their advice has shaped your approach to leadership in this new field.
They've really given me, perspectives from their individual lenses that they look through, so that again, it's all about information, distilling it quickly so that you can make good decisions that will absolutely change or shape the direction of the company. And so by having that, that diverse board from multiple aspects um, of industry, they really have helped me, shape and guide the strategy of how we can accelerate the company and how we can do it appropriately. One of the things that is a deterrent, believe it or not, and it's actually a deterrent in cybersecurity, is there are all kinds of companies out there that make false claims. I mean, how many companies out there that say, if you buy this widget, you'll never have a cyber breach. And again, Palo Alto fights that every day, right? There's no evidence to support those claims, but there's lots of noise in that channel. And it's the same thing with cancer treatment. And this is where it does actually a pretty big disservice. Is there's lots of companies out there that are saying, we've got the cure for cancer. Or, there was one story, and again, this is the stuff that breaks my heart. An osteosarcoma patient was buying mangosteen juice at $100 a bottle, and he was drinking a bottle a day because somebody said it's full of antioxidants, this magical juice from the rainforest, and it will cure your cancer. And
Mhm.
he was spending that money, and he ultimately died from cancer.
Yeah.
And so, what our board of advisors has really helped guide us in is to how to separate ourselves from that noise. And again, that's why it was produce the evidence, get published in a top tier journal, and then ultimately that's where you rise above the noise, because now you have the evidence and it's independently validated and it's published by a top tier journal. And that's, again, that's how you separate yourself from the noise. And fortunately, that, again, that's part of the guidance that this advisory team that we've got has really helped us, take these steps so uh, that we don't get too far out in front of ourselves, and to really do things in a sequenced way to help us always stay, above the noise, if that makes sense.
It does. I think having that a level of passion and focus on what you're doing drives you, and then
Right.
you want to go out and tell the world about it. But it is helpful to pause and to come back and say, "Are we sure? Did we validate? And can we get somebody else to come in and take a look at the work we've done and make sure that our bias or excitement is worth being excited about?" And if it is, then that amplifies you and accelerates you rather than becoming the juice fraudster that's out
That's right.
there, maybe
Selling
believing
snake oil.
yeah, believing that it's useful, but in reality it isn't, or fraudulently selling it, because you're a cold-hearted individual. What advice would you give to IT leaders that are considering a similar shift? Maybe they want to move to a different industry or into a leadership role. How should they approach that and navigate it?
One of the things, and again, David, you touched a little bit on it. Mentorship is incredibly important in every walk of our life. We need to be giving back as mentors, but we also have to surround ourselves with really good mentors. I would, the advice that I would give any IT professional, any security professional, anybody out there is, don't let anybody tell you there's something you can't do. Solving problems is solving problems. And it doesn't matter if, I have a PhD in microbiology, which I do not, but it's about, surrounding yourself with the right team and solving problems. And then I think the third piece of advice that I would give everybody is every time you step up to the plate, swing for the fences. You may not always hit a home run, but you should expect to hit a home run every time you step up to the plate. And, quite frankly, that's how I got my board of advisors. I had an opportunity to meet Bill Seibel, who is a serial entrepreneur, an author, again, group Cambridge Technology Partnership. And when I saw that I had an opportunity to meet with him, I swung for the fences. And fortunately for me, he was passionate about what we're doing, and opened up every aspect of his experience to help us along. And I think the fourth thing that I would share is don't be afraid of failure. And I hate the word failure, but it's if you're if you're not failing, you're not pushing the limits of your own abilities and the limits of technology. So you if you're gonna fail forward. Again, it's like an incident response process. There's always a retrospective, right? And it's
Right.
the same thing. If you try something and it didn't work, do the retrospective and come back and do it again differently. Learn from that and push the limits of your technology and your own abilities to advance these companies. And you can do amazing things, and you can do anything that you want to do.
Jim, your company uses AI to match patients with effective treatments, and broadly, AI is playing a bigger and bigger role in so many industries. As a CEO and former CISO, I'm curious how you see the role of cybersecurity evolving in the AI era.
Yes. I mean, again, AI it isn't the panacea, um, but it is the ability to examine massive amounts of information quickly
Right.
and correlate it in a way and present it back to a human that ultimately can help us make better decisions faster. You mentioned taking the Nature Medicine article and running it through Chat GPT, and you had a confidence factor, right? AI will allow us to you know examine petabytes of information quickly and do that correlation, but ultimately, it's the person behind that data that ultimately has to make the decision. And sometimes that decision is based on data. I mean, when I look at how I made some of my decisions as a CISO, they were either based on data, based on prior precedents, or based on, and this is my least favorable one, but my gut tells me this is where we got to go, right?
Yep.
And so I think AI will help transform all industries, including the medical industry, because it helps us synthesize mass amounts of data that help support better decision making faster.
That's really encouraging, Jim. So let's go ahead and wrap up here. What's the most important thing somebody should remember from this conversation?
You know, um, a couple of things. One, my hope is to better inform people about cancer and how cancer is being treated. Because until you enter into that world, you really don't realize that this industry is the industry that's the next one ready for digital transformation. But we have to do it safely, and we have to do it with evidence. So I would say the you know be informed, because your doctor is just a human, just like you and I. And so, play an active role in your healthcare, working collaboratively with your doctor. I would say to an IT or security professional, problem solving is problem solving. We all solve complex problems. Don't limit don't limit the your view of solving a complex problem, even something like cancer, because you don't feel like you have the experience or the background. You may not, but you know how to solve problems, and surround yourself with good people who complement you and can help you solve problems. And I think the third is don't limit yourself based on fear. Every time you step up to the plate, swing for the fences, you're capable of doing anything that you put your mind to. I mean, I look at myself and I'm like, you know, 15 years ago, I didn't know anything about cancer. And now I'm, leading a company, fortunately, that is full of experts that know a lot about cancer. So, I kind of say I'm the poster child for you can do anything. If an old CISO like me could help, bring this next generation of cancer treatment into the industry that's ready for disruption, anybody is capable of doing anything. And I think the last thing is continuously learn. Continuously learn. You've got to continue to push the limits of technology and the limits of your own abilities. And the only way you can do both is be a constant student.
Jim, really well put. Thank you so much for coming on Threat Vector today and talking to us about your journey and the work that you're leading. I've learned quite a bit, and I think it's a really interesting jump from security to security or to CEO that you've made and are making an incredible impact.
Well, thank you. I appreciate it. And, hopefully it has inspired that next generation.
I found Jim's transition from CISO to CEO of a biotech company particularly compelling because it illustrates the profound impact personal experiences can have on our professional paths. His shift was sparked by a very personal crisis, his son's cancer diagnosis, which drove him to seek out and implement more effective cancer treatments using AI. This move underscores the potential for personal motivations to catalyze significant career changes and innovations. And it highlights how skills from one field, like cybersecurity, can be transferable and highly effective in other fields. By applying his background in security to the medical field, Jim's story reminds me of the lessons learned in David Epstein's book, Range. In the book, Epstein makes the case for generalism, a broad competence in many areas rather than an extreme mastery of one. Jim's career started in technology and IT, dove deep into security, and then pivoted to a role as a biotech CEO with First Ascent. Just as Epstein argues that diverse experiences contribute to innovation and problem solving, Jim's career pivot illustrates how cross-disciplinary approaches can lead to groundbreaking advances in fields as critical as cancer research and treatment. That's it for Threat Vector this week. I want to thank our executive producer, Mike Heller, our content and production teams, which includes Sheila Drosky, Tanya Wilkins, and Danny Miller. I edit the show, and Elliot Peltzman mixes the audio. We'll be back in 2 weeks. Until then, stay secure, stay vigilant. Goodbye for now.